Good afternoon, good evening, ladies and gentlemen, wherever you are in this little world. My name is Alex Pashov. I'm from Crystal Touch Clinic in Rotterdam, the Netherlands. We'll take a few minutes to give the time to our visitors to join our session. And in the meantime, I will tell you a few words about the clinic so you have a better idea. I'm sure that you have been following our publications on Instagram here, and also probably some of you have also visited our website at crystal-touch.nl and have already familiarized yourself with some information. I believe it's a useful information about facial palsy, about the Bell's palsy, about recoveries, and other useful information that we have specifically created to help Bell's palsy sufferers to get some ideas about what they can expect, what they cannot expect, what should be done, what should not be done, in order to maximize your chances for recovery. And if you have not recovered fully, then what you can do or should not do in order to overcome, or at least to reduce maximal extent, your complications and residuals. Once again, this is Alex Pashov from Crystal Touch Clinic. This is our first live transmission. Let's begin. Crystal Touch Clinic in Rotterdam, we have been founded many years ago in 2008. And before that, we have had an extensive experience in the aesthetic branch, preventing aesthetic aging, and as from 2008 we are specialized only in facial paralysis and in rehabilitation programs to treat residuals and complications of this functional disorder. Our patients come from all corners of the world. More than 80 countries are represented, so to say, in our patient list. And we are doing our best, everything which is within our ability, to help everybody who asks us for help. And of course, another thing is that if your particular situation is complex and difficult, and if you want to receive really personalized analysis of your particular situation, feel free to write us via our website. There is a contact button, or the possibility to register for a video session to analyze your particular situation. There is a question already. I will answer it just a little bit later because we have a few questions have been asked earlier. So I will begin. First, I had little improvement since my onset, but should I worry if I still can't smile after 1 month? No, you should not be worried, because although the majority of facial paralysis cases recovers pretty quickly within 3 to 5 weeks, then there are some cases, statistically speaking about 15% to 20%, where the damage or injury to the facial nerve has been more severe, and the recovery may take longer time. It may take up to 3 months before you can see first signs of recovery. And I wouldn't say this is normal, but this is not something uncommon. So don't be worried. The recovery will come. So this was question number 1. Question number 2, probably also from a patient who is now in the acute phase. Should I use hot compresses on my affected side? Yes, you should. The idea behind hot compresses is that we do all we can to improve the blood circulation in the area and to increase the lymphatic circulation in order to reduce as much as possible the swelling and compression of the facial nerve, which is in 99% of the cases happens here in this bone, which is called the pyramid of a temporal bone. In that little bone, there is a narrow channel, which is quite long, up to 33 millimeters long, and it has an S shape. And in that channel, the nerve is very vulnerable. If so there is any inflammation, any disruption in blood supply, or any other external factor that affects that area, the facial nerve can sustain injury from most of the time is from compression. So when you apply dry heat on that area, not to the face, because face is not, it's not where the damage to the nerve is. Most of the time is here. The facial muscles fail to work due to lesion here because their signals cannot pass. So that's why hot compresses would be good, but of course don't do it in a very fanatic, so to say, way. Do it with moderation, use your common sense, and of course you use massages and other ways to improve the blood circulation and to harmonize your face, especially in the acute phase. The third question which we have had is chewing on a chewing gum during Bell's palsy. Can it help my nerve to recover, or will it make it worse? Well, from my point of view, chewing gum will do neither of those. It will not help your facial nerve to recover, neither it will help make the things worse, because chewing gum is chewing, and during the chewing process, the muscles of your facial muscles are trying to work, and of course your affected side cannot work. That's why, and chewing gum or not chewing it, it does not have any effect on the area where, as I just said previously, most of the time the lesion has taken place. So that's the answer to that question. Another question from the patient in the acute phase of the facial paralysis. Please, I have been suffering from Bell's palsy for more than 2 months. I had treatment but only recovered about 10%. Please, what can I do? Is this permanent? I will answer the second half of the question first. It is not permanent, and as I said earlier, the recovery can take longer time than just a few weeks. So don't be despaired. Don't worry too much, because as I said, the recovery will come, and it just may take some time. If you need us to assess your more particular situation, please make contact with us directly, and we will take it from there. We'll assess your particular situation and answer all your questions, which will be in our force. So the question which we have received, the first question we received from our visitors: what does your procedure for synkinesis treatment look like? Well, it's a very good question, and I would be very happy to answer it in a few words, but unfortunately it's not possible, because it's not a procedure itself, it's a rehabilitation program which consists of many parts, many modules, and definitely what it is not a quick fix, because from our point of view, synkinesis is, to the contrary, what the common understanding is. It is not a miswiring. From our point of view, it's a wrong mimetic habit or conditioned reflex, which have been formed during the long recovery process. And I can tell you what we do not do. We do not do facial exercises, which has various names. Here in the world, it's called mime therapy. Here in Holland, it's called neuromuscular retraining, or it could be just facial exercises. We do not do that, and the reason for that I'll probably need to explain in a separate publication, because it's quite lengthy explanation. And unfortunately, during this short session, we do not have possibility to go into much of details. So if you really want to have a answer to the question, what it looks like, please make a contact directly with us. We schedule for you a special video session, and during that session I will answer all your questions in as much details as our time will allow us. Second question received from our visitors: do you have practical steps to advise that we can do at home to help manage synkinesis? Example, self-massage, cold warm compresses, and so on. Well, the practical steps that we always suggest to our patients: first, do not force your face into facial expressions. From our point of view, forcing your face into facial expressions will only make things more complicated, because then you will be forcing your muscles into contractions, and as a matter of fact, you will not be forcing your muscle, but you will be forcing your brain. And that is what exactly it is definitely want to avoid, because too much of contraction signals in the direction of the facial muscles would lead to over-contraction, over-amplification of those signals, and definitely they will push your face out of control. What we do suggest, spend some time during the day just, I wouldn't say meditating, but just quietly, sitting quietly, listening to your face and trying to notice, to focus on your healthy and versus affected side. Try to notice the differences in contraction levels, what you feel different, and then try to consciously relax those muscles and spend 10-15 minutes, preferably twice a day, with that practice. Second, what indeed self-massage, very important, but please pay attention that you don't do only on your affected side. Always do it on your both sides, because it's very important for your brain to receive symmetrical sensory signals coming from both sides of the face. That way the brain would be harmonizing the picture of your face, because at this moment the picture from your affected side versus your healthy side is different. But what we need to do, and the brain just gets sucked into that imbalance, what we need to do, we need to kind of remind your brain that your face is one whole, that the signals from both sides should preferably be symmetrical, and that is the reason. Second reason why you should be doing your facial massages. Do it quietly. No need any special techniques. There are very many publications on YouTube with the various techniques of self-massage. Whichever fits you best, whichever makes you feel the most comfortable, the most relaxed, pick that one and do that. Of course, don't do it on a dry skin. Apply a few drops of massage oil or massage gel so you don't pull your skin unnecessarily. Spend 10-15 minutes doing your massages quietly. The general rule, from midline to the outward, and from the down part, lower part of the face, outward. Don't pull your face all over the place. Just do it gently, as you would do for your beloved little child or a little baby. Definitely, foam compresses could be of help, but only in the sense that they will help you relax your face. Whatever you do, try to do it on both sides, so your face reacts to whatever procedures you are doing in a symmetrical and well-balanced fashion. Cold compresses, I definitely disadvise. We do not recommend cold compresses, because we need, as I said earlier in this session, we need to have the most optimal blood supply, blood circulation, lymphatic circulation, and of course the cold application of cold will compress will constrict your blood vessels, and definitely will not achieve the goal that we aim at with our procedures. The next question, there are a lot of questions already, so I will be trying to speak a little quicker, and maybe I will be a little brief in my explanations, because I want to answer as many questions as possible. And if you need any more detailed explanations, please feel free to contact us directly, and I will be more than happy to answer all your questions and also assess your particular situation. You are very unique and hard to find any specialist clinic in Europe. Why do you think it's so hard to get the right advice? Well, it's difficult to answer this question without trying to push ourselves forward. Probably the answer is that we have decided to specialize only and exclusively in this particular functional disorder. And we have accumulated a lot of experience, a lot of observations, a lot of scientific research we have done. We have presented our views at the whole rehabilitation process in European and world congresses for neurorehabilitation, and also on the congresses on neurology. And I think probably we think differently. We did not take for the face value what has been written in each and every neurology book which we got taught in medical schools. We just, well, think differently. And to get the right advice, well, you are joined this session, so I believe you are on the right track to get the right advice. Again, I'm not trying to push myself or our clinic forward, but just I want to underline that we look at things differently and we analyze symptoms differently, and that's probably the explanation in a quick way why our results are also different. The next question: do you believe synkinesis is caused by overacting on exercises, or is it simply inevitable for some cases? It is a little bit of both. Synkinesis is not caused by overacting on exercises, because even if the person does not do the exercises, the synkinesis are very likely to be formed anyway if the recovery of from this functional disorder takes longer than a few weeks, which indirectly means that the injury to the facial nerve has been severe and the nerve takes longer time to recover. The fact that facial exercises may emphasize or may facilitate the forming of synkinesis is indeed, from our point of view, the case, or might be the case, because, of course, to say it for certain, quite complex and difficult to execute research is necessary. But again, one day I will make a special, probably video, not a lecture, but a video piece of video advice, where I will try to explain why we think that doing facial exercises very enthusiastically may be contributing to the forming of synkinesis. But basically, due to also your voluntary or involuntary facial movements, or at least intended facial movements on your affected side, the synkinesis in one or the other form and one or the other grade of intensity are very, very likely to form if we are talking about the long recovery process after the facial palsy. Again, I have to apologize. I have no possibility to give a very detailed answers, because we have a lot of questions, a lot of visitors, and I really want to answer as many questions as practically possible within the given period of time. Next, why does every other specialist think synkinesis is a miswiring, not a habit? Well, I cannot say why every other specialist thinks synkinesis is a miswiring. The most probable reason is that it is written in all the medical books. And all the books on the neurorehabilitation, it is written. I have been researching this issue and did quite a lot of reading, trying to come to the core, to the first instance of this idea, and have come to that. It was in 1975. There was a paper from American Professor Jun Kimura about the synkinesis as a result of aberrant regeneration. But Professor Kimura mentions that aberrant regeneration takes place only in the cases when the integrity of the trunk of the facial nerve has been compromised, which means if there was a trauma, during the operation, if the trunk of the nerve was severed, so its integrity was compromised, then the miswiring or aberrant regeneration may take place. In other two cases, which may lead to the facial paralysis, Professor Kimura did not mention that the miswiring was likely to appear. But in the subsequent publications, this notion have already been extrapolated, has been generalized to each and every, to be the case in each and every case of synkinesis formed. And that is the reason why the prevailing opinion is that it is miswiring. There are other versions of causes, probable causes. If you go to Wikipedia and look at facial synkinesis, you will see the other two. They are much less popular. but they exist. There were publications that would advocate those. Next question. I usually feel tense the neck area, including my mouth. I have had 3 years of Bell's palsy. Any advice? First, I would like to comment a little bit on the question itself. You don't have 3 years of Bell's palsy. You have 3 years after Bell's palsy, because Bell's palsy is an acute and complete paralysis most of the time of the one side of the face. But I can assume that if you are asking these questions, then your face has recovered to a certain extent. So we don't speak anymore about the paralysis, Bell's palsy. We are talking about the long recovery period, its residuals and complications. Tense the neck area, including the mouth. Indeed, here it's called the surface muscle of the neck is called platysma. And around the mouth here, most of the time it's in the lower part of the mouth, there is a muscle which is called depressor anguli oris. This is the muscle that pulls down the mouth corner. And these two muscles, they are attached to the edge of the lower jaw. And they are also very close to each other in our motor cortex, which, as we all probably know, at least most of us know that the motor cortex manages all the movements of contractions and relaxations of all the muscles in our body, including the facial muscles. So, advice, as I said, don't force your face into facial expressions. Spend as much as possible as your lifestyle allows you time reflecting, listening to your face, relaxing consciously your muscles, and keeping them relaxed for as long as you possibly can. And that, I mean, twice a day, 10-15 minutes would be very helpful. And if you do it regularly, consistently, I'm practically certain, I don't have a crystal ball, but I'm practically certain that you will feel less tension in that area. Because we need to change, again, talking about our concept of the synkinesis, we need to remind our brain that Mr. Brain or Mrs. Brain, thank you very much, but it's no needed anymore to over amplify the signals. Even the background, the tonal signals are not necessary to be over amplified. So we need to change the habit. That's why it takes the rehabilitation with us. Well, in any case, even not with us, it takes so much time, because we need to overcome the already formed habits. And as we all know, it's very difficult. As they say, it's better to create correct habits from day one than to change the habits that already have been formed. Next question. Can the synkinesis be corrected? Bell's palsy started in November 2020. It's about 2 months. My mom started to have synkinesis. November, January, February, March, April, May, June, July. So we have now 7 months. Indeed, synkinesis usually starts to form between the months 3 and month 5. After the first signs of recovery, let's say after 2 months or 3 months, the face becomes better and better, and then the patient becomes overjoyed and happy, and then the synkinesis start to appear approximately between 1 or 2 months, sometimes a little longer, since the first day of the signs of recovery. Why it is exactly this, I cannot tell, because I don't know. I don't have all the answers. But the question was, if the synkinesis can be stopped or reduced? Yes, they can. However, our experience tells us that the synkinesis will not go away by themselves, for a simple reason that it is, again, from our point of view, it is a habit. And habit does not go away by itself. You should be working on that. It is practically impossible to give one-size-fits-all advice during this session or during any other session for that matter. It requires quite consistent, intensive, regular work during a extended period of time, and that's exactly what we are doing together with our patients. And that's what I would suggest that you also aim yourself at. Not necessarily with us. Someone else may be also able to help you in that. I hope so. Well, our approach seems to be quite different from the rest of the world, but I'm not sure. I'm sure that there are specialists who will be happy to help you to the best of their abilities and knowledge. By the way, there was a little question: do your clinic have locations in the United States? No, we don't. We don't have any branch offices or clinics in other countries, so the choice is pretty limited. We are in Rotterdam, the Netherlands, and that's about it. The question, next question. I had 7 Bell's palsies in my life, 2 times the nerve on the same side, didn't recover, 100% difficulties with my eye, dryness, etc. Any suggestion for it when it comes to go to bed at 9 time? Well, if you're in an acute phase, and even if you're not in an acute phase, use the artificial tears, sometimes the ointment before you go to bed. If you are in acute phase right now as we speak, use the eye patch. There is also such thing which is called a moisture chamber. It's a kind of sheer plastic cover which can be glued to your orbit, and that has little openings to allow still the exchange of air between the outer space, but it's still and in your eye, but it very efficiently prevents from your eye drying during the day, and of course for the night, to avoid any dust or any other materials getting into your eye, consider patching it for the night. Do you think that taking prednisolone 2.5 months in would provide any help? Well, we have to realize that prednisolone or prednisone or any other steroids, these medications, they are not medications against facial pulse. We have to be very clear about that. Prednisone or prednisolone is the medication that is aimed at reducing swelling and fighting the inflammation. As far as that is concerned, prednisolone is a medication of choice for the treatment of facial palsy, but it is not without side effects. So 2.5 months, in my opinion, is far too much, because again, prednisolone does not affect the regeneration intensity of your facial nerve. If the nerve has been injured, it needs to regenerate and to regrow. And prednisolone is definitely not the medication. There is no medication anyway that would improve or facilitate the regeneration of the nerve, because the regeneration capacity of your facial nerve very tightly is connected and related to the general condition of your body. If you are anxious, if you are tired, if you are stressed, if you are physically very much challenged and so on, that all affects the regeneration capacity of your body. That's why, in generally speaking, during the acute phase, it's recommended. Rest, positive emotions, normal nutrition, good positive nutrition, and refraining from falling into the panic and picturing yourself the end of the world. It is not. The recovery will come. It may take time. It may not come within 10 or 15 days. It may not even come after 2 months, but it will come sooner or later. I have to say that if that is the case and the recovery comes very late, there is a very high probability of some residuals and complications. But again, it's not forever. If you are prepared to do something, to invest your time and effort into work, into consistent work, then it is possible to reduce those, and that's our opinion about the situation. Is stretching useful? How does it help most for the straightening the tight muscles? Well, stretching is definitely useful, but on the other hand, you should not be overdoing, because stretching is physical, let's say, deforming or stretching your facial muscles to reduce the level of their contraction. That's the thing. Does it help most for straightening the tight muscles? Not exactly, because your muscles are contracted not by themselves. The muscles by themselves cannot contract, because they need to, how shall I say? They need to contract, the muscle needs to receive a contraction signal from the brain. Without signal, the muscles is just proteins, contractile proteins, and that's about it. So in order to straightening the tight muscles, to relaxing the tight muscles, you need to stop this stream, or to reduce the stream of contraction signals coming from the brain. And that is why conscious relaxation, focusing on your muscles, left versus right side, affected versus healthy side, and paying attention each and every moment to what your face is doing, and as I call it, listening to your face, is very useful. And again, touching your face with your hands. By the way, your hands is the best rehabilitation instrument that have ever existed, and in my opinion, it will ever exist in the future. Nothing would come close to them. So use your hands, touch your face. If you feel any painful spots, any knots in your muscles, do it gently, massage them gently. And again, pay attention that you do not over contract your muscles. Don't force your muscles into facial expressions. Can synkinesis be treated 7 years after the onset? After 7 years or 10 years or 20 years or 30 years, the answer is absolutely yes. Treated is not entirely correct term, in my opinion. Treated is, if you consider it as a disease, then it can be treated. As I said, synkinesis is, from our point of view, is a habit. So to change your habit is never too late. If you want to change your hand script, is it too late to take a calligraphy lessons even when you are 85? No. It will probably take longer time to become a calligrapher if you start at 85. But Leo Tolstoy, as they say, learned to ride a bicycle at the age of 67. And also it was not too late to develop that new habit. So it's never too late to work on the existing habit, to reduce it, and to replace it with a new habit which will be useful and welcome. Do you recommend Botox for synkinesis, or do you feel it is contraindicated? Well, it's a difficult question, not a difficult question for me to answer, but it's difficult to comment. I'm going to comment anyway, because Botox is very often recommended as a treatment for synkinesis. What actually Botox does, Botox is a commercial name for botulinum toxin, which direct translation from Latin is sausage poison. Botulinum toxin is a neurotoxin which paralyzes, paralysis is a result, which blocks the transmission between the nerve and the muscles. So when we inject the botulinum toxin into the muscle tissue, what it does, the molecules of the toxin, they get to the neuromuscular junction, which means it's the place where the nerve meets the muscle, and block the transmission of the signals from the nerve to the muscle. Of course, as a result, the intensity of synkinesis reduces, but it does not address the core cause of synkinesis, which we already discussed a few times during this treatment. So I wouldn't say that it's contraindicated, but injections of botulinum toxin is addressing only the symptoms. And if you really want to be doing it every 3 or 4 months or 5 months, whatever it takes for your body to recover, to regrow the side branches of the intoxicated nerve, to reconnect to the muscle, because that's what is happening. Botox kills the neuromuscular junctions forever. It's not reversible. So the nerve would just grow side branches to reconnect to the muscles, and that is the reason why Botox effect does not last forever, because the body is trying to restore the damaged tissue, and then you have to do it again and again and again and again. And again, if you're really interested, please make a contact with us. We'll schedule a session special for you, and I will answer this question in very much detail with a lot of explanations and examples and so on and so on. Do you have any experience on whether B21 or any other medication can help in the late recovery period of Bell's palsy? As I said, late recovery period, I would name it 9 months plus, because during the first 9 months, the recovery of the facial nerve goes pretty intensely, pretty active. Of course, its intensity reduces after approximately 5-6 months and reaches usually practically a plateau after 9 to 10 months. And then the improvements in the quality of connection between the brain and the facial muscles through the facial nerve becomes really actually incremental. But then by that time, the recovery level of the nerve reaches such a level, such a quality, that it stops being a major problem, but the major problem shifts to synkinesis, excessive contraction levels of the facial muscles, tight rigidity of muscles, some painful spots, crocodile tears, and so on and so on. If we are still under recovery, is it recommended to apply COVID vaccine? Well, we have had a lot of questions about this lately for obvious reasons. From my point of view, there is no definitive answer to that question. Why? Because first, we are lacking really serious, massive, statistically substantiated research on that area. 2,000 or 3,000 or even 10,000 examples are not representative. We are talking about hundreds of thousands, if not millions, of statistical records which could be analyzed to give statistically significant results. I always answer to my patients who ask similar questions about the COVID vaccine. Well, you should, if the question is that you are afraid that the facial pulse will come back after the vaccination, you should consider the risk or lack thereof, which you want to avoid more. If you want to avoid more the risk of relapse of your facial palsy, it's one thing. If you fear more the risk of getting a COVID, it's another thing. And of course, not everyone experience COVID in its very extreme case when you need artificial ventilation, oxygen, and so on. Majority of people confront it in a really mild or even light form, and so it's up to you to consider all the risks and fears. So I don't think that it is contra or indicated for the patients after facial palsy. Of course, vaccine is a extra load to your body. That's for sure, because it impacts your immune system and impacts the general regenerative capacity of your body. And if you are really in the acute phase, your face is still recovering. Well, you should consider whether you want or do not want to subject your body to an extra challenge. Next, 70% recovered and it's just hit 1 year since onset. Do I still have potential to recover? Usually by the 1 year mark, the situation with recovery stabilizes and reaches a plateau. As I said earlier in this session, if you mean by further recovery, if you mean to get rid of your synkinesis, contraction, hypertone of your facial muscles, and other unpleasant symptoms, then I would say that by themselves, you definitely have a potential to recover, absolutely, but not by doing nothing. That's very important. By itself, those complications and residuals are not very likely to go away. And that's at least what our experience tells us. As I said again, I don't have a crystal ball, and each and every case is very different, very individual. Each and every person is different, has a different body, has different mental structure, has different emotional structure. So that's why it is all needs individual approach, and that's exactly what we are doing at the clinic. We do every patient receives he or her own uniquely composed rehabilitation program. So that's what we do. But absolutely, you do have potential to recover. But again, by doing nothing, you will not realize that potential. With your program, is there 100% recovery from synkinesis? No. For a simple reason, that synkinesis is a habit. And in theory, it is possible to overcome the habit completely, get rid of it completely. But probably you would agree with me that if you want to get rid of any habit that you have completely, it will take a lot of time and effort. And what we are aiming at in our rehabilitation programs, we're aiming at what we call aesthetically acceptable result. acceptable for the patient, of course, because trying to fight those last 15-20% of remaining synkinesis may take you another 2 or 3 years, and this is definitely not our preference that you just keep coming back, trying to get rid of those 15%. If you are really a perfectionist, that you are very welcome to do that, but I think on the practical side, when the majority of the symptoms is gone, or at least substantially reduced, then you can just carry on living your life. Look, not one face in the world is symmetrical. Look at my face. I have here a ripple, which I don't have here. I smile when I smile to one side, most of the time to my right side. My nose is to one side. So what? We are all unique. If you were all 100% symmetrical, we'll be all like factory dolls. But that's not exactly. If you look at the picture of the most popular actors, actresses, politicians, very popular persons, if you just mirror their face with a simple Photoshop or any other photo processing program, mirror them to the opposite side, you'll see a different person. Although we think they are ideal, they are symmetrical, they are perfectly balanced. No, they're unique, that's right, but they're not perfectly balanced, they're not symmetrical. Next question. I have developed synkinesis. What can be done to reduce the effects of this? Is it permanent? I already partly answered this question in the previous, answering my previous questions. As I said, synkinesis is a habit, and you really have to realize that to get rid of the majority of it, or to reduce it at least substantially, you really have to be very, very consistent. Doing something for 5 minutes once in 3 days will not do the job. And again, not because I want to push ourselves forward, but because you need guidance. You need somebody to watch your successes, to watch your progress, because it's difficult to do it on your own. It's not because I'm trying again to push you into anything. It's just because it takes time and consistency. My face affected side is swollen all the time. Do I need to give warm massages, or there are any other hacks for reducing this swelling? I assume that you are now in the acute phase of the functional disorder, and it could be. It's difficult to say whether it's swollen or just a little bit more full than your healthy side. If it's just a little bit more full, then it could be due to the lack of movement of your facial muscles, which in turn reduces the blood circulation and lymphatic circulation. So the lymph and the, let's say, water stays inside your facial tissue and makes it look a little more puffy. But if it is real a swelling, then I don't have you better see a doctor to see whether the swelling is a result of something else, because by itself facial paralysis that does not lead to real swelling of the face, unless these are Guillain-Barré syndrome or some other more specific and more complex disorders. I'm on week 11 and I saw the first tiny movement on the 7th week. I have a very slow progress. I now feel an eye muscle move when I yawn. Does this mean that I already have synkinesis? Well, most probably it is. You don't have synkinesis yet, because if you're on your week 11, which means that you are at almost 3 months, it's a bit too early, but not to exclude that it's possible. If you have a eye muscle move when you yawn, it could be one of those, but I'm sure that even your healthy side is also moving when you yawn, or only you probably not pay attention, or just contracts in a bit different way. But as I said, synkinesis are very likely to form if you are at week 11 and the first tiny movement on week 7 and the progress is slow, then the chance is very high that there will be some residuals and complications. Not guaranteed, but the chance is very high. All right, at this moment we don't have any more questions, at least not those which I can answer within this given period of time. It's about time now to finish this session. We are about in 1 hour. If you have any questions which you wanted to ask but you didn't ask, or if you asked questions which you did ask but they didn't answer them because there was no more time, please feel free to write us an email, ask that question, go to our website, to the knowledge base. We have quite an extensive knowledge base with illustrations, explanations, with videos. Invest some time in that. And of course, if you really want us to assess your situation in detail, answer your particular problems, answer your particular questions, and discuss with you the possibility for you to recover, register for the online diagnostics. Also on our website, this possibility. And I will be happy to do the online, because I do the online diagnostics all the time. And I will be very happy to meet you online, to answer your questions, to analyze your situation, to give some basic suggestions. And if you will be prepared to work together on your improvements, then we'll probably take the next step in the direction of your rehabilitation program. And now I thank you very much for your time, for your very good and interesting questions, for your commitment to your recovery, for your readiness to do your own effort, not to expect anyone to do any miracles, but to do your own effort in order to recover and to bring back your smile.